Welcome to a free on-demand webinar presented by Michigan Alliance for Families. We partner with experts from across the state to offer live webinars to help answer the questions we encounter most frequently. Our webinars are recorded and archived for future viewing. Handouts for our webinars can be requested through our webpage, michiganallianceforfamilies.org/webinar. Remember to keep up with Michigan Alliance for Families on social media and be sure to check out the other videos on our YouTube channel. Follow-up questions to this webinar can be directed to us at info@michiganallianceforfamilies.org. Today's webinar is Behaviorist Communication, and we have with us Dr. Sally Burton-Hoyle. Welcome, Sally.
Good afternoon, everybody. I am very happy to be here and talk to you about my very, very favorite topic. And the reason why is that it is something that I've kind of learned through experience in my roles as a family member and a teacher and an advocate for persons with disabilities. So again, I'm happy to be here. I've got my information on the front in case anybody wants to email me. So, and again, how I kind of learned this whole behaviorist communication thing was growing up with a brother with autism. I learned, first of all, that it really didn't matter if a person had language or not. My brother had autism, and there were constant therapies. ABA, for those of you who think it's new, has been around forever and ever. And so in the 60s, between that and speech and language and all different sorts of things that kind of, I have to say, were seen as aversive by my brother, who didn't seem to react very well to them. And so people would try to get him to talk. And I quickly learned that words didn't matter, and that it was the behavior that somebody showed that was more indicative of what they were processing and how they were processing the situation. So that's a theme I've kind of carried through, and I'm very glad that it has. And it's certainly something that with my teachers that I am training to be special education teachers, that they all come back and tell me that they really do use that, where they look at the kid, pay attention to the kid, as opposed to waiting for the response. Another thing I learned in growing up with my brother that has everything to do with behavior, and that is relationships. And if the person doesn't have people that accept them unconditionally, and by that I mean not, I guess I have such an aversion to when people don't want to have conversations with people with disabilities unless they use their words. And I think that can be seen many times as, not a good thing, and that relationships matter. So people don't need to, just like with my best friend, I don't need to be on my best behavior when I'm talking on the phone with her. With my husband, I don't need to be perfect, right? So we think everybody's got to have words, and it's like, no, if I have a relationship with somebody, that's going to carry me through. It's going to calm my anxiety. It's going to help me. It's going to just help me through the process. So if you think about why inclusion is a good thing, we want to have other kids be helping our children. With the family picture there is my picture. My brother is the one in the orange. And I'm happy to say the last 10 years of his life, he was in Michigan and had self-determination and lived in an apartment and had staff 24/7 who honored his behaviorist communication. And the fun and the relationships that we had in my family with my brother were not based on him doing anything for us necessarily. It was that we accepted him. So I kind of want to make that point, because in working with families of individuals with autism and other disabilities for so long, they kind of feel like, well, he can have a relationship, but he's got to have language first. And it's really not, that's not the case. So with your children, if you're thinking they need to make friends because they need to make friends, they don't need to be able to talk first in order to have friends. So just something to think about. It's like, and how do you begin that process? You begin by seeing what is your child like, and then putting them in more situations with things they like and interests that they have, as well as other people who share that same interest. Okay, so today we went, hopefully, and I will be anxious to kind of see your questions and answer them at the very end. So we might have to just kind of run through some of this stuff, but I hope you understand when you leave this webinar today that all behavior is communication, so that this applies to all of your children. This applies to your husband, your neighbors, your in-laws. It's everybody. And I think we all, when we think about it, and we've all heard that, nonverbal communication is 90% of how we communicate. I think that we might all understand that and think that a little better. Sometimes when it comes to people with disabilities, people get kind of unrealistically high standards and think, well, they have to be able to communicate the way I communicate. No, it is up to us to interpret an individual's behavior as communication. That's where you start. If a person doesn't want to stay in a room, for you to acknowledge with language to them and to then use that as a teachable moment is important. Then we're going to talk about what are some of the things behaviorally that make sense. And I'm going to give some examples both from my own personal life with my brother and other things as well. We're going to talk about the role of illness in challenging behaviors. Again, the power of relationships and how important they are should be a theme throughout. Strategies to prevent challenging behavior. We kind of why this is so important to me is that there is a law. It is illegal in Michigan schools to seclude or restrain somebody unless it's an emergency, right? And I kind of want to kind of go through some of that. And then we'll talk briefly about what a functional behavioral assessment and positive behavioral supports are. And I'll just be so brief on those is because there's other wonderful Michigan Alliance webinars that will talk about positive behavioral supports specifically. Okay, so if we look at the term behaviorist communication, it refers to an individual's efforts to communicate dislikes, needs, desires, but they can't because of a communication deficit, no speech, limited speech, or support with appropriate communication technology. I think there's been so many improvements in supporting people with appropriate communication technology, and I think we're learning that you just can't hand an iPad to somebody and say, use your words through this. I mean, that's going to have disastrous, results. One of the things I've seen, I'm doing a lot of work in California this year, and they have as a regular, and many things, trust me, are not great. We've got great stuff going on in Michigan. But one thing they do have is through speech and language therapy clinics, therapists, both clinically and in the schools, they have something called communication partners, and goals are written so that if you have somebody who needs to use the iPad to communicate, that there is support with peers, because if peers and family and brothers and sisters aren't a part of that, it isn't going to happen, and it isn't going to happen with the kind of regularity that we have to communicate. And that's just as important as those who, in thinking of autism, to have, they don't have that quick ability to initiate or find verbal language. And I work with college students with autism. They can't initiate verbal language, okay? It has nothing to do with intelligence. It has to do with the neurology of a neurological disorder, such as autism, cognitive impairments, learning disabilities, some of those sorts of things. So behaviorist communication is that overall effort that everybody communicates. We never want to say, well, he can't communicate. No, everybody communicates. And so those are some of the reasons why we have to look at it. Okay, so I think we need to start at the beginning and think, what do we all want in life? What do we all want in life? And if that doesn't seem like it makes sense, behavior has to do with how we are interacting and engaging with the environment, right? And I think too many times in schools, other people, they look at behavior as a separate thing when, let's go back to the beginning. What do we all want? What do we all want? We all want to be accepted. We all want to be able to make meaningful choices, right? And choices based on who we are as people, not choices based on what the teacher or the parapro decides are appropriate choices. I think of the example of, I've been school seeing student teachers and consulting all over the place, and I have been for too many years to count. And a teacher said, I asked her how she was teaching choice, and she said, well, I will give the person 2 choices that are appropriate. And if they take more than 10 seconds, then I make the choice for them. And I think, well, that isn't a choice, then is it? And so it has to be choices based on your critical and observations and the critical observations of those people that are around that individual. We have to be engaged in meaningful activities. If we are not engaged in those things that we see as meaningful, I'm going to give an example, a blatant example. Somebody is 30 years old and we're teaching them how to tie their shoes. Okay, that's not going to be meaningful because chances are they've been doing that for 28 years. Somebody's been trying to teach them that. Is it something that is based, people need to be doing things based on their strengths and their interests. What are their interests? What are their interests? And many times people see pathology as pathology. For instance, I had a brother that loved to pick up tiny, tiny things off the floor, little tiny specks of lint or things like that. And a meaningful activity for him, besides recycling, because he loved to do that, he loved to look at the barcodes and things like that. A meaningful activity might be picking up little things off the floor because and let's think that, oh, okay, that could be something that's needed. I wish, right now there was somebody doing that in my home or in a job. It's important to keep the area clean. So I think we need to think about what do we think is an appropriate behavior and think, could this be a job skill? We all want to be surrounded by people who care about us. People who like us, not people who insist on that they're not going to interact with us unless we are appropriate. Air quotes around appropriate because I don't know what is really appropriate in this day and age. So I think we need to have unconditional support by people who can, and as families can, laugh and cry with us, right? We need to be listened to and heard by others. Like sometimes an individual doesn't want to do something. So they're communicating through their behavior, for instance, that they don't want to go in the room or they don't want to get off the bus. And people just get all high and mighty and think, no, they need to do it. They need to listen to me. Let's acknowledge. First of all, you acknowledge and say, wow, you do not want to get off this bus today. And then you need to do some detective work to figure out why do they not want to get off the bus? What is it that's aversive about walking down the hallway, about going to their classroom? Same thing with if they won't get off the bus to come home. That's kind of a real, a big example. But I think that if we don't acknowledge what people are upset about, then things are not going to get better. We all need to be loved. We all need to have people around us that we know do care about us. Not every single person loves us, right? But everybody needs to at least act like they respect us, right? I think that's something that is missing so much in many classrooms and settings because of the inappropriate behavior sometimes of people talking about the child, the talking about the student, we'll say. So if you've got a parapro and a teacher standing 2 feet away from the student talking about all the bad things they've done that day, you're not going to feel like anybody really respects you. So what none of us want to be ignored. None of us want to be ignored until we use our verbal language, for instance. And I see a lot of that, like use your words, use your words. Many of us are thought to be incompetent. The example of standing by a person and talking about them is the surest way to tell a person that you feel they are incompetent. I was working with a group of adults with disabilities, and one lady said to me, when my staff talks about me like I'm not there, I feel like a brick has hit my stomach. So I think of that all the time, and it's like, if you've ever heard anybody talk about you in an unkind way, I think that's, that would be your reminder about what it feels like to be incompetent. None of us should be abused, controlled, bored just because somebody gives a stack of worksheets and the person is obviously bored. I have real hard talks with my teachers about this, and I say, you don't want to admit that somebody's inappropriate, challenging behavior in your classroom might be because you are boring them. Let's look very, very openly at what might be boring. None of us should be ridiculed. None of us should be ridiculed. Now, I'm not going to say in a family that there aren't some things that are funny. I remember my father, when my brother might do something funny, he would say, and I would say, well, I shouldn't laugh, and he'll say, laugh or cry. So I know that sometimes within families we might laugh with the person, but none of us should be ridiculed. Nobody should be restrained, and I put being restrained right up there with being abused. And I think that if we have a behavioral program dependent on restraint and seclusion, that's just a real bad program. And I'm happy to entertain questions about that, or you guys email me and I can talk with you later about that. None of us want to feel like we're disliked, and I think sometimes if somebody said to me, well, I'm only going to talk with you when you say the things I want to hear, I would feel very much like I was disliked. Okay, so the function of problem behavior, because there's a reason why people do this. There's a reason why a person might repeat something over and over again, or try to leave an area that we don't think they should leave, or whatever it is, or knock things down, or not pick things up, or whatever. So problem behavior is a way for the individual to communicate and tell them about the opportunities in their life, about the lack of control that they have in their life, and an overall poor quality of life. It's like and I think that all of us can relate to, if we are not happy and we are feeling like we don't have control in our life, we probably make some poor decisions. Maybe we eat too much, or drink too much, or sleep too much, or stay up too much, or whatever. And I also think that the problem behaviors, and I talk again very strong way with my students that are going to be teachers. It's like, if you use instructional or behavioral strategies that aren't respecting their individual preferences, if you talk too much for somebody that has got sensory processing issues or an unresolved medical issue, let's think about somebody that is, I'm going to use this example because I just dealt with it. Somebody that's dehydrated. They're dehydrated, and because they don't say, I want water, or they don't say, I am very thirsty, then the behaviors that ensue might be something like spitting. And I learned this from an OT. Many important things I've learned from OTs. A student that is spitting all the time is maybe very, very dehydrated, right? Okay, so an unresolved medical issue, it could be that. I can't stand very much people talking. Very many people talking. One person maybe needs to talk at a time. And if there's a whole classroom full of people talking, then I shut down. Okay, so let's think about that. That's behavioral strategies that are not respecting the individual preferences. How you get around that is letting that person wear their earbuds, headphones, whatever, their stocking cap pulled over their ears, if they do have to be around a big group. So frustration with boredom. And, so many times, more times than I can count, I've seen students that are punished because of bad teaching practices. For instance, if I have a plan as a teacher that they do all these things in this center before they can move on, and they don't like those things, and whether they've been doing them for too long or it's that they can't do them, they don't know how to do them, they don't want to do them, which leads right into a lack of choice. Now, I want to say something about choice. Choice should be, again, meaningful things that they are interested in. And it's never anything I recommend openly. Okay, so it's like I can't say it's free choice time today. It's free choice because that will raise a person's anxiety mightily. It's better to say, here are 5 things. Just like you take your child to the refrigerator and open up the freezer. If you match this to what's appropriate and say, okay, these are the 3 things we might have for dinner. Like, will you please hand me the one you want? So they're looking their eye level with the freezer and they're saying, okay, and they pull out the frozen hot dogs or whatever. Then it's like, okay, let's thaw these out and let's have hot dogs. So, kind of leading us into the importance of visuals is that if we use verbal language and say, make a choice and it's too open-ended, the person many times will just walk away or not answer. Or what if you say, do you want this? Again, auditory. Auditorily, I say, do you want this or do you want this? The person generally will just pick the second thing. And the reason why they do that is because the choice is too overwhelming and the auditory processing is the weakest link for so many people that have neurological and challenging behaviors. Okay, so what happens when we can't communicate what we need? So we've got people telling us use our words, but we can't. And that isn't a functioning level thing. That's maybe you're overwhelmed. So you're overwhelmed, and you can't tell me what you want. You scream, you cry, you run away. You're a small child. Maybe you go and take other people's toys away from them. Maybe you pull hair. You get I've seen this so many times with parapros in classrooms that I'm in there watching because they believe the child has such challenging behaviors and the parapro is talking, or the teacher is talking to them too much. And what happens is they might scratch at the person's face, pull their hair, push them, overall kind of making bad choices. So I think, add in any behavior that you want to think like, oh, I wonder if that's why, for you guys to look at, and then let's move on because I'm going to make sure I allow time for questions. Okay, so why do we say use your words? I've always wondered about that, and I have been in numerous occasions in classrooms and other settings where an individual who's maybe had little to no functional language ever in their life, and thus they communicate through their behavior, is told, use your words, use your words. And if somebody told you, if I came and jumped through the screen and put duct tape around everybody's mouth, and then I punished you because you didn't tell me what was wrong, I think that is the best comparison, is that we say use your words when people do not have that ability, due to neurological, psychiatric, to anxious, whatever the reason is. So I think that, and I've also seen where people say use your words until the person is very upset, and then we hand them, let's say they can communicate, with an iPad. But then if they're so upset and we hand them that afterwards, what happens to that iPad? It gets thrown. I've seen that time and time again. Sometimes people have the idea that if a person has visuals or technological supports, that they're never going to learn to talk and they're never going to use verbal language. And it's just the opposite, because if I have the technology that supports or the list in front of me that acts as a prompt, my anxiety is going to go way down and I'm going to be much more calm and I am going to use my words. I would watch something interesting. I would watch if my brother had a new staff and they would talk and talk to him too much. They would talk and talk to him. He couldn't look at him and he would look away. But when he was with me, his anxiety was low because he knew I understood him, and his eye contact was amazing. And I always thought, if I am with my brother, I can ask him things and he responds verbally. Okay, if other people begin talking kind of at him, don't allow enough processing time, then usually there would be a behavior from him, which was he would vote with his feet. He would get up and he would leave the room. And then other people would mistake that for that he didn't care what went on. So I think that we use this term, use your words, in an abusive manner. And I think instead we need to help people. We need to use those teachable moments. Somebody's getting upset. We acknowledge they're upset. And maybe we teach them. That's the time to say, I don't like this. If they've never had words, then maybe it's a physical gesture that we teach them. Let's say somebody's getting too close. The best physical gesture is to put your arm out. Okay, so it's like we need to take when people are upset and help by teaching them words or teaching them prompts that they can use that other people will acknowledge as communication. Okay, if using words was possible, they would use it. Okay, again, I work with college students that maybe got a 35 or 36 on their ACT, which 36 is the highest you can do. Or maybe they've got 1450s on their SATs. They're brilliant. Their vocabulary is immense, but they cannot tell me when it is they want something or need something, right? So if using words was possible, they would use it. A child may have a large vocabulary, but may not be able to retrieve the right word and then use it in a way that makes sense to others. Sometimes we've got an individual that when they're upset, they begin reciting something. They go through a whole cartoon, act out a whole cartoon, go through a whole script, the whole scripting thing. Scripting isn't bad. Scripting tells us that they're upset about something. Then what is it that we do about it? Okay, and I think that people kind of want to put the kibosh on what people would call what echolalia. Somebody's, it's nonsense, it's gibberish, I'm not going to acknowledge it. What it should be acknowledging, what we should be acknowledging is that person's upset. When I'm upset, I'm going to talk about something that I know every word to. Okay, so, or if I do not have the means to verbal language, then I might just vote with my feet and try to escape an environment. Okay. Okay, since the sensory problems impact behavior. I've got this as, this was a picture of my brother with my mom, and my brother had lots of sensory issues. And I want to ask you all to think about the sensory problems that might be impacting your child or your student or whoever it is you're thinking about. Because if I am around somebody that's too close and I don't like that close feeling, I'm going to get upset. And I will then go into my repertoire of how I show that I'm upset. Do I begin rocking? Do I begin repeating something over and over again? Do I hit the person? Do I reach over at the person who's sitting next to me and take their glasses off and break them? all of those things, which I have witnessed people do many occasions, and people then say they take it personally. They say, well, they hate me, or they say that behavior needs to be eliminated and all that kind of thing, rather than thinking about, let's look at all the senses. Let's look at the sense of smell. Are you wearing a very strong perfume or body wash or hairspray or some? Or have you been around cigarette smoke? So is there something through the olfactory sense that is impacting the person's behavior? Because if I've watched students who they don't like the way the teacher smells, and so they won't sit by the teacher. And the teacher takes that as non-compliance. They take that as defiance, and then punishment ensues. Kids are suspended, all these sorts of things based, kind of rooted in the sensory issues. Let's look at visual. If somebody is impacted by too much visual stimuli, they're going to react in a way that is going to look like challenging behavior. Kinesthetic, tactile, any of those sorts of things. A child won't eat, or they spit out their food. Any of these kinds of things might be the root of that, and that's where hopefully you've got a team of people that are working with with your son or daughter, or whoever it is you're thinking about, because if there's sensory issues, that's got to be a multifaceted approach. You can't just say, well, they don't have language, so I'm going to teach them language, because if we don't teach them, understand what the sensory issue is, vis-a-vis work with the occupational therapist, then we can't just have ABA over and over again with somebody, when it's really the root of it is kind of how they're interacting and how they're looking at the environment. So if you look at what the definition of sensory processing disorder is, they have an inappropriate, incorrect response to the environment. So they walk into a room, and it's a room that we don't smell anything different. We don't see anything different. We're not bothered by the lights, but they are bothered by the lights. And so then they try to engage in a behavior which we should be able to reframe as, oh my gosh, there's too much noise, too much sound, too much light going on in here. Okay, so I'm going to give some examples, go through some examples that we dealt with my brother. Okay, so a lot of times you get reports on a child, your son, daughter, whoever, whatever the age is, and you think, okay, well, wait a minute, well, this doesn't make sense. I think you need to really be very critical of things, reports, incident reports, things like that, and you need to kind of start thinking, well, wait a minute, what about this? And you need to develop questions. Okay, I'm going through some examples so you guys, we can practice on that. My brother was obsessed with doors opening and closing, and if he were to sit in a restaurant facing the door that might open and close, his anxiety would be out the window, and he would be trying to get up and shut that door, or not let people, leave, or something bad about, regarding the door. When the accommodation for that was, don't be facing the door. It's pretty simple. So my parents, when my brother was going through voc rehab assessments for employment support, told them, the people with vocational rehab this. And they ignored it, and as they often do when parents give great information and advice. And the job they put him in was working in the frozen food section of a Costco. And every time the door opened, so they had him stationed by the vast, and in Costco, all those aisles that are frozen foods, and they had him in a certain aisle. And what he would do would be, people would take food out and put it in their cart. He would go to the cart and take it out and put it back. And he did that with such regularity that they said to my parents, he's unemployable and he cannot work. When in reality, that was just the wrong place to them. So it's like, did it make sense that my parents were ignored and then they tried to not ever put him in another employment situation? No, but it didn't make sense, and it isn't fair, and all those kinds of things. second example I'm going to talk about was once my parents passed away and I moved my brother to Michigan, and he lived in an apartment. I had 24/7 staff, and this was soon after, maybe a month, 6 weeks after I moved him to Michigan. And I went every either Saturday night or Sunday night, and we planned it. We had it on his calendar that I would pick him up at 5:30, and I would take him to my house, and we would eat dinner, and then we would get in the car at 8 o'clock precisely and head back. So I was on the way to pick him up at his apartment, and the staff called him and said, we are not going to allow him to leave the apartment. He's too upset, and we think his behavior is dangerous, and we're not going to allow this. So I heard him in the background, and he was saying he was repeating September 15th, September 15th. It was shortly after, September 16th or something. And that had been my mom's birthday. And she died the year before, and we were around that date. It made perfect sense why he was upset. He was sad. He missed my mom, because you know what? When you have a disability, you're allowed to have the exact same emotions that any of us would on an anniversary, right? We all have had that experience where we don't understand why we're tearing up, and then we think, oh, well, gosh, it was the anniversary of my dad dying or whatever. So the first thing I did was say, oh my gosh, Tim, that's mommy's birthday. And you're sad, you miss mom so much. I'm so sorry. And he went immediately silent. And he said, yes. And so then to the staff, I said, I'm very sorry that I didn't tell you that September 15th was my mom's birthday. Because if they would have known that, maybe they could have done some proactive kinds of things with that. So it didn't make sense that I didn't do that, but that he would have been punished. What if I didn't say that, or what if it was somebody else? What if it was staff that was going to take him out to dinner, and then they just wouldn't because his behavior was dangerous? A lot of times people with disabilities have dangerous behaviors for darn good reasons, okay? We need to figure out what those reasons are. Then next with my brother, they did this behavior plan that included calling the police anytime he would go up to an apartment number, 201, and he would shake the door on it, okay? He would shake it. And so they didn't know how to stop that, so they just said, okay, well, we're just going to call 911. When he does this, which was the stupidest idea I ever heard of, because we do not want to invite police into the lives of people with disabilities. That does not have a good ending in most situations. So anyway, I started asking questions, and I said, well, okay, first of all, where are you walking when you're walking around the apartment complex? And they said, well, we're walking to the mailbox. And I said, okay, well, why are you walking to the mailbox? And they said, to get his mail. And I said, does he get any mail? And they said, no, he doesn't get any mail. And I said, so what is the purpose of this activity? And they said, well, he's overweight. I said, okay, then let's think about other ways you can walk. And for instance, why don't you walk across the street to the fitness place that I bought a membership to? And/or why don't you walk to the 7-Eleven and go in and let him get a Diet Pop, that he loved Diet Coke, and let him get that. So introducing things that make sense, because none of these things made sense. So let's go on. Okay, so then some more things and these are things generally I've seen. If you grab a person's chin to make them look at you, or you mistakenly think that because someone's looking at you that they're paying attention, that eye contact really is not the measure of if somebody's processing something. So what we're teaching somebody, if we grab their chin to make them look at you, is if they want your attention, they're going to grab you by the chin. And that can have very, very bad results as they grow into adulthood. So the idea that anything we do to a person, they will learn to do with others. Another thing, if we give tokens to people for their response, what that teaches them is I don't need to respond unless there is a token. We don't want that. That doesn't make sense. And another thing that doesn't make sense is like, I'm all for behavioral consultation. Trust me, I do that. But a person can't come in and just tell you, well, you need to do this, you need to do that, until they know the entire situation. And even then, they should be asking you questions, because strategies are going to be useless and not positive in nature unless they are doing it from your perspective, your meaning whoever knows that person best. I see people turned off all the time, like they go, oh yeah, we don't want. And I remember my own parents that the social worker would come and observe my brother with my parents, which was a horrible and upsetting event for all of that, everybody. And they would begin telling my parents things they should do when that really wasn't helpful. They should have been asking my parents questions about how does my brother respond to this or that, if they wanted to have a conversation with them. What if we do this? What if we ignore the individual unless they're performing the behavior correctly, or they are using their words or something like that? The unintended outcome of that is that the person is lonely, frustrated, and ostracized from others. So I think that's a very, very important thing for us to think about. And you need to ask yourself, does this make sense? Okay, then let's talk about choice and control. If a person does not have choice and control in their daily life, that's going to increase their problem, their behavior. Okay, if they do not have control, they're going to have challenging behaviors. Okay, if you have the idea that a person is too low functioning to have a choice, then that person's behavior is going to get extremely challenging. If I don't give you any control over any events in your life, then I'm going to have lots more challenging behavior. The idea that it's never too early to begin with choices and giving a person control over things. And how then that works is that it's age appropriate, that we make certain that if somebody's 2 years old or 3 years old, that we lay out a couple of shirts and say, choose the shirt that you want. And same with control. Do you want to do this first or this? So if we think about now and next first, then letting people have some control over the order of some of the things. It will decrease problem behavior. When I am with somebody and it has severe and extreme problem behaviors, the first thing I will ask is, what kinds of choices does the individual make in their life? And people don't see the relevance. And to me, if you look at it in your own life, if you do not have to have choice and control in your life, you're going to communicate through your behavior as well. So if an individual has choice and control over as much as makes sense, we're going to see an increase in appropriate behavior and a decrease in problem behavior. So that's something that think about the amount of choices. Think about that. And it's never too early. It's never too late. Okay, another thing that is critical, just like I still don't know why my brother responded to apartment number 201. Okay, there's a reason for that, right? I just didn't know it. And as a parent, you need to look for other people that know who your child is. Just like teachers, rather than assuming that they know the reason why a person is misbehaving or demonstrating challenging behavior, they need to assume there is a reason for it. We just don't know it. How are we going to know it? We work as a team. We must collaborate. We must all collaborate. And as much knowledge that families and schools, for instance, or families and agencies, community mental health, whatever agency, the more that is common knowledge, the better off for that person. Please don't ever allow this to become a part of your life. If there's ever any professionals telling you, don't tell the school that the child is on medication. Don't tell them that they're on a special diet. Any of those sorts of things, that's just going to not have a good effect. We need to all be working together to figure out kind of why somebody is responding to the environment or a person or behavior in the way that they are doing it. Because if we understand, then we can either switch it around. Just as we were doing a functional behavioral assessment for a young man. And what we discovered that the route from the classroom to the lunchroom was such that every day they'd go by the music room. And then he would try to run in, and then he would pound on the piano. That then everybody would try to pull him off, and it was a restraint situation, when instead, why don't they just go a different route and not walk by this? So sometimes people think that the person has to comply, as opposed to, where's the compromise? There always has to be compromise. And if the person walks to the lunchroom, how they get there, really, as long as they're staying in the building, really shouldn't matter. So collaboration is what matters. I think all of us as family members know that how to tell if a person, for instance, is getting an ear infection. Perhaps if you have a child that's nonverbal or they use behaviorist communication, there might be certain sorts of things that they're doing. So physical illness can cause challenging behavior, because if I don't know, the mailman just came, so forgive me for my dog barking. I think that we need to always kind of look at and think like, well, what could be causing that? What could be causing that? My own brother, when he had ear infections, when he was still very small, we were unable to know that. And finally, then my parents were able to figure out that every time they took him to the doctor and he was acting in a certain way, that it was ear infection. So urinary tract infections, if you're looking at individuals with psychiatric issues, if you have a urinary tract infection that looks like psychosis, that many, many times people are admitted to psychiatric wards, and then they find these things out. So just like think about the age and the relevance to that. Diabetes. There are many, many disorders that have behaviors that are specific to that person, not, having, some sort of impact on their health. How about the side effects of medication? We need to understand what those are, and you need to be knowledgeable about what those might be. We need to think about food allergies. We need to think about thirst or hunger or the need to go to the bathroom. It's that many times we kind of punish people for having a disability because we're saying, use your words to tell me that you need to go to the bathroom, and then the person has an accident, as opposed to thinking, well, we probably need to get some kind of visual schedule in place, so that we can give this person things to drink and take them to the bathroom when they need to. Never, ever, ever should basic human needs be used as an incentive. People need to have water, to their, I'm not saying gallons and gallons, because that's a whole medical issue in itself. But if somebody's thirsty, then they shouldn't need to perform a certain thing in order to get that. I've seen that used in not a good way sometimes. Somebody was having the child eat potato chips, and then they wanted them to say certain things in order to get their water. And that is unethical, and that should not happen. We need to honor who people are. If a person's having pain or discomfort, perhaps, why do they have a stomach ache? Is it related to the last thing on the list there, which is constipation? Is it related to menstrual cramps? I've seen team meetings. I was in a team meeting once about a woman who was disrobing, who was stripping out of her clothes at certain points. And I began asking, because I was kind of going through that too. And I said, well, is this woman who was in her 50s, was she perhaps going through menopause? And they were like, oh my gosh, they didn't even think about that. So it's like sometimes there's very normal kinds of things. I was also in a meeting once where they were tracking data on a young woman who they said every 2 weeks her behavior spikes. And it's like, okay, could that be premenstrual syndrome? And yes, indeed it was. A person without language that does not have behavior that's communicated and interpreted can have horrible dental problems. There can be self-injurious behaviors for the person from dental problems, from migraines. There are different kinds of very, very severe kinds of things that can happen. I worked with a young man that was putting his fingers in his various parts in his body all the time. And they had behavioral consultants. They had all kinds of people working on that. And I asked this question. I said, does he perhaps have hemorrhoids? And everybody was like, oh, well, I didn't think about it. Well, guess what? He had hemorrhoids. So again, you have to, at the very beginning of any kind of functional behavioral assessment to challenging behavior, you have to rule out the sensory and medical sorts of things. And then constipation, we need to be aware of, and there are some individuals who have gastrointestinal issues that just constipation is a regular part of their life. And sometimes made worse by medication. So we need to understand what that is, and so that that person is not, I've seen families resort to that they're just giving the child enemas regularly as opposed to having the person go to the bathroom at school. And then there are sometimes when kids will only go to the bathroom under certain conditions, and maybe it's only if they can be in their home and things like that. But we have to be very, very careful about that because that can be quite a terrible health problem. Okay, the root of escalating behavior. So lots of times people kind of think it's an emergency, and I'm bringing this up because if we say, let's say a student is secluded or restrained regularly, and then the systems continue to say, well, it's an emergency and I'm allowed to do it in an emergency. Let's look at what this emergency exists. It's because of mistakes made by people in charge, agents of control. If every time a person has a substitute teacher, there are certain things that happen, then that's on us, and that needs to be a team meeting and an amendment to the IEP about some things that might happen. In other words, we need to, and I say this we to teachers, is that we need to understand our role in it. If you, on the other hand, if you're like as a family or parent, you're taking somebody to the mall and you say you're going to do these 3 things. We're going to do this, we're going to do this, we're going to do this. Or we're going to the grocery store, we're going to get these 3 things. And then you think, oh, but he's doing well, so then you stay longer. And then the person has a terrible meltdown. Okay, that mistake was made by us. So we need to, as best we can with people with extremely challenging behavior, we need to plan. Proactivity is the cornerstone of any positive behavioral supports. The person needs to understand what the expectations are, and we need to then follow our rules. Okay, so behaviorist communication. So I'm going to kind of go through some different sorts of things and what they might be communicating, keeping in mind that anything can be communicating. And a person that's fighting themselves with one person, it might mean I don't know what to do next. But with another person, it could mean I don't like who I'm sitting by. So I think we need to look at the entire repertoire of reasons why a person might be communicating. So let's say somebody's saying they want to go to the bathroom, they're handing you the bathroom pass, or they're always asking. Or let's say you're a parent and the teachers say, well, we're wondering if you need to do some kind of medical check because they're always asking to go to the bathroom. I want you to think about all these things, because if they're wanting to be out of what should be a reinforcing environment, then I guess it's not very reinforcing to them. And for some of the reasons that they have no idea what to do next, we're saying to them, use your words, or they don't like who I'm sitting by, they don't know how to do the work, there's sensory sorts of things. I don't like the perfume the teacher's wearing, I don't know what words to use. So any of these things, disrupting class, screaming, running away, getting under the desk. Now, then the last thing, repeat wetting their pants, wetting themselves repeatedly. That is or kids disrobing. They're wetting themselves and taking off their clothes. That is the ticket out of school. Okay, so when students have gotten to that point, when people have gotten to that point where they begin disrobing because they will then get suspended or sent out, then it's a plea for help on their part that we need to please look at what it is they're communicating so that we can fix it. Okay, if I see that somebody's wanting to go to the bathroom too much, I immediately work with the teacher about, is it clear? Are their expectations clear? And many times a teacher will say, it's very clear. How do you know it's clear? Then the teacher might say, because I tell them. Well, many neurological problems, learning disabilities, cognitive impairments, autism for certain, is that they don't they don't process. That is their weakest link, is to process auditorially. And maybe they need to be visually supported. So there are sometimes, like, if somebody is misbehaving really badly, and a teacher then goes and says, come out in the hall with me, young man. Well, that never has a good ending. Instead, it's better to write. I like sticky notes. I always have sticky notes. So on a sticky note, go put it on that in front of that person and say, can I please talk to you in the hallway? That's going to have a much better outcome than me calling that person out and saying, hey, what is it we can do? Okay, and kind of as we're winding down, and I know we're kind of getting over time here, but I guess I want to say why it is that we're always talking about positive behavioral support. There's webinars that MAF does, Michigan Alliance for Families does, that are excellent, so please go seek them out. But I want you to, let's just kind of refresh here. Positive behavioral support, as we're talking about it, is, and it's, usually it's not there when people have challenging behaviors. It's an understanding that we can't control others, that we cannot make somebody comply. I really don't like that term comply, because I think that most of us are not very compliant, and it's for a reason. When we're not compliant, then it is something that we need to further study. It's a belief that there's a reason behind most difficult behavior. So it's like if somebody has a neurological pattern of prior to seizures that they do or say something repeatedly, then we need to understand that, and we need to still use it as communication, but we need to understand that it's part of a neurological or medical issue. It's just as if somebody has Tourette's or tics or something like that. It's the same sort of thing. And it's a conviction to continuously move away from coercion. You'll do it because I tell you to do it is not anything that has anything to do with looking at behaviorist communication or positive behavioral support. And these are, and I'm just showing this as we talk about PBS. There's the tertiary prevention is that which I generally provide, and that is a one-on-one sort of significant behavioral challenges. If you study more on the primary sorts of things that are done in the bottom level and the secondary ones that are across systems and classrooms, that maybe you have to figure out what it is you need or your child needs. Okay, what happens when we don't look at behaviorist communication is that the person is confused, because remember, they are communicating the best way they can. And isn't it sad if the best way a person can communicate is that they have to kick the wall? But sometimes we have taught them that that's what they need to escalate to. We have taught a person that they need to escalate to pushing somebody over or slapping somebody. because that's what they've needed to do in order to get out of an environment. It's a loss of self-esteem. It increases people wanting to escape, avoid us and other things, and overall increased frustration. Okay, and these are, you guys can come look at these later, but it's like again and again and again, we see repeatedly that people are, that we ignore their behaviorist communication. The last one is something I want to talk about, so we can go to the next slide, because it is, it was the emergency situation that occurred when Michael Renner Lewis was walking towards a parapro, and that was misconstrued, and then he was restrained for several hours until death. Okay, so this emergency of is a system failure. So when it appears that anybody needs to restrain, seclude, or put hands on, it's because of the lack of our skills to address the situation. And I teach this to students and student teachers throughout every opportunity I can, is that when you lay hands or allow people to lay hands, restrain, seclude, it is that you don't know how to address the situation rather than the actual need for such strategies. Okay, possible signs of restraint and seclusion, and this goes both ways. If you're a teacher or if you're a parent, you're seeing bruises on your child, on your student. The behaviors are escalated, and they're not normally, they're different kinds of behaviors that are escalated. They're anxious about things that normally they weren't anxious about. Increased self-injurious behaviors, rocking, pulling eyelashes out, pulling hair out. All of a sudden somebody's scared to go to school. They're scared to get on that bus and go to school, and they're refusing to get on the bus, and instead of thinking, whoa, what's going on, we need to discover at the other end what it is they are afraid of. Bedwetting, fear of a particular teacher might be, if you hear somebody repeat somebody's teacher, or my brother would repeat staff that he did not have good situations with. He would cry when he normally didn't. People don't sleep. They don't want to be left alone. They all of a sudden lose their appetite when they, when they normally do. And then the last one I've added from my own experience that I learned that through a big case that I worked on, is that all of a sudden the mom pulled out a spray bottle of water because she was ironing, and her son freaked out, just, hid in the closet, wouldn't come out, screaming, crying. What she learned was that was being used in a therapy session when he didn't emit a response. So pay attention to all those things. Whoever knows that person best needs to be paying attention to these things. This is the definition of what physical restraint is, and it is anything that immobilizes or reduces the ability of a student to move their torso, arms, legs, or head freely. And it doesn't include a physical escort. Let's say somebody's getting upset, and so we kind of touch the back, we hold their hand, and we walk them out of the room. That is not restraint, okay? It is an immobilization, reducing the ability of a student to move. Mechanical restraint, which is not allowed, it's any device or equipment that restricts a student's freedom of movement. This includes bungee cords, okay? And I've added that because I have been witness to people being kept in their chairs with bungee cords, because then it allowed the teacher to work with other students. It's not okay, and it is considered a mechanical restraint. So seclusion is then, which is, again, it's illegal unless this is for an emergency. It's the involuntary confinement of a student alone in a room or area from which the student is physically prevented from leaving. So that means if you have, timeout is not seclusion. Okay, I want to just say that right out. Timeout is a time away from reinforcement. Timeout can occur in the classroom. For instance, somebody could put their head on the desk as a timeout. So the idea that people have timeout rooms does not make any sense, okay? It is a seclusion. I mean, if you put somebody in a timeout room, that is seclusion, because that is the involuntary confinement of a student alone in a room or area from which the student is prevented from leaving. Now, they cannot lock that room. They are encouraged and supposed to have a window in it so that the student can be monitored. And then also they're prevented from leaving, not through locking, but through staff standing in front of that door and not allowing the student to leave. It usually does not have good results, and I think that much post-traumatic stress disorder and other bad and challenging, inappropriate kinds of behaviors many times can be linked to this practice being used too much with them or at all. Okay, this is Michael Renner Lewis, and this is his mom, Catherine. And he was in his first day of school in Parchment, Michigan, in 2004, and he was nonverbal, had autism, was experiencing a seizure as he was walking towards the paraprofessional or the teacher, I forget which, in the cafeteria. And she was calling his name, and as he continued walking towards her, she felt threatened, and so she had the restraint team come in and restrain him. They then took him to another location at the school where 3 people sat on him for a couple of hours until he passed. And in fact, 90 minutes past his death, he had people sitting on him. Problem? Yeah, problem with seclusion, restraint, and aversive practices. It can result in death. It can result in injury. And at the very least, it results in a person having a bad reaction to it, throughout their life. And whether it's a post-traumatic stress disorder diagnosis or every time you go by a certain area, and I think many of us have had the experience, somebody's going by a certain street and an individual gets upset. People that don't know them think, oh, wow, they're just getting upset. Ooh, they're just losing it. And if you know that person, you know the reason why. And that reason why is what matters. And the acknowledging is what matters. Okay, when to reduce anxiety, have schedules. And whatever the visual of choice is for that person, whether it's real pictures, whether it's a now and next, and they just see 2 pictures at a time, if they see 3 things at a time, whatever it is, think about the use of visuals, because it's a surefire way. And there's visuals for schedules and there's visuals for communication. So they're 2 separate ways that might increase the quality of life for your loved one. Okay, functional behavioral assessment is, and I just gave you like the first couple of questions, but it is something that is done, that should be done when a manifestation determination has happened. Okay, so let's say we do that manifestation determination after the person's been suspended, according to IDEA, or on the 10th day that they're suspended, a manifestation should be called. And one of the common outcomes of the manifestation determination, which is to look at, is behavior and the disability. There is a disability, the result of the behavior. That's the purpose of that. But lots of times if they haven't done an FBA, then they'll do one, an initial one, or redo it. And what we do at that is we look at what the behavior is, and we try to figure out what are the events that predict success, what are the events that predict problem behavior, what are the consequences when a student, and it goes, there's other questions, and I just gave you the first 6 for purposes of this interview. And once you do that functional behavioral assessment, you should move directly to a positive behavioral support plan. And the thing you want to think about is the purpose of a positive behavioral support plan is we take the information from the functional behavioral assessment and then we concoct a plan that's going to increase the quality of their life. Okay, in order, like if a person is behaving in a certain way, we have to figure out why. Why are they doing it? Is it because they need communication supports? Then yes, we want to give that person communication supports so that then friendships and the meaningful outcomes of life can occur. Okay, and more questions, and and how will typical peers be involved? Because when you do a PBS plan, we have to have specific strategies and the inclusion of typical peers for the PBS plan, and then a monitoring of the plan and regular meeting of the team in order to monitor this plan. Okay, so kind of wrapping up here, ways to reframe behaviorist communication. We want to start off presuming competence. And that means you look at the person, you speak with the person. You don't talk about and around the person. You begin to identify strengths and interest are what should rule your decisions about how it is you are providing support. We want to give age-appropriate amounts of choice and control. And that would include visual and maybe even for some people manipulative. You might, if you show a person a picture of something and they don't respond, then you need to go to the actual object. We need to always look for environmental barriers. If that person doesn't want to go in an environment because it's loud or whatever, let's figure out a different way in there and a different time, perhaps. You need to always put yourself in that person's place and see what I want to do, what this person's doing. And to teachers, I always say, would you trade places with this individual? And if you would, if there's nothing you would change, usually when I say that, they always kind of get a look on their face like, oh, no, I wouldn't want to do that. Well, okay, then let's figure out that they have a life worth living.
Thank you, Sally.
You're welcome.
Michigan Alliance for Families is an IDEA grant-funded initiative of the Michigan Department of Education, Office of Special Education, and we're Michigan's federally funded Parent Training and Information Center funded by the U.S. Department of Education, Office of Special Education Programs. Follow-up questions to this webinar can be directed to us at info@michiganallianceforfamilies.org or call our